I'm the session chair of the session of PS11 training in health and sports. And we still have the second presenter missing, Francesco Bona. If the second presenter is available, please come to the front and check your setup. No. Okay. Then it's time, so let's get started. So welcome to the session Training in Health and Sports. I'm Katsutoshi Masai from Kyushu University, Japan, and I will be the chair in this session. The first one is the effect of haptic feedback in an immersive microsurgery simulator on VR training and skill transfer. The presenter is the Intisar Sharif. Please start your presentation.
So, hello everyone. I am Intisar Sharif from Paris-Saclay University, and I worked with Aylan Wika, Amin Shilali, Mohammed Babahnini, and Samir Othman on studying the effect of haptic feedback in an immersive microsurgery simulator on VR training and skill transfer, which I'm going to be presenting today. So the first question that people would ask is why VR surgical simulators and not the traditional methods that people usually use and that worked for years? Actually, it didn't work as needed. As we can see here, for example, there are hundreds and thousands of people who are yearly victims of severe medical malpractice. And from here it comes the conclusion of the High Authority for Health report. Never the first time on a patient, which acquire the development of new technological simulations for learning technical or medical skills. So one main reason behind exploring this field is the ability given to trainees to learn repeatedly in a safe and trained environment without the fear of the real life consequences such as harming human beings and animals, and also the ability of an automated assessment. But when we talk about trainers, we talk about effectiveness. So the main question would be is how to design suitable systems that provide effective trainings. So we can say that if we want to provide, let's say, an effective training experience, we have to build simulators that can transfer the knowledge learned or the skills learned inside the virtual environment to the real environment, which is based on making the virtual and the real setups closely matched. And here, for example, we can see that both environments look the same. But an interesting question would be, can we feel the haptic feedback when we are interacting with the tools, for example? Can we feel the force feedback when we are inserting a needle in a virtual environment? Because functional tools and haptic feedback are crucial in learning technical skills because they give the trainees the ability to focus mainly on the procedure they are doing, and also they give a realistic experience. So a simulator without haptic feedback may not train learners to deal with the interference between the tools and the virtual objects, such as, for example, the human body, the tissues, the organs, etc. So it won't allow them to master the haptic skills needed in the real life. So haptic feedback appears to be a requirement for the design of surgical simulators. And a lot of research supports the importance of adding haptic feedback into surgical simulators. They noticed that it accelerates the learning performance process. The skills also improve significantly. It provides shorter time to complete a task. And mainly also, advanced tasks requiring superior precision benefit more from the haptic feedback than the basic tasks. And however, the benefit of haptic feedback is not universal. Until now, it still depends on the task, the procedure, the training experience, and most work focus on the performance in the VR environment and not the skill transfer to the real life. And that's why we focus in our research on studying the impact of haptic feedback, not only on the performance and the user experience in the virtual environment, but also on the transfer of these skills from the virtual environment to the real world, and also the retention. And to study this, we chose the microgrid coloring task, which is a standard warm-up in microsurgery. It involves filling tiny 1 millimeter squares under a microscope, demanding high precision, control, and also hand stability. And despite the simplicity of this task, it's actually a validated process or proxy for microsurgical skills, since the performance on this task correlates with the stuttering, speed, and also quality. So we adapted this microgrid exercise to both physical simulator and virtual simulator. The task was to accurately and fully coloring the 10 diagonal squares on the grid under magnification. This allowed us to measure both the precision and control of applied pressure. We recruited 33 participants, and they were randomly divided into 3 groups: the haptic group, the training with haptic feedback, non-haptic group without haptic feedback, and also a control group that does no training. And all participants performed in the physical simulator during the pre-test, the post-test, and the retention test, but only the haptic and non-haptic group did a training in the virtual environment. So we structured our study around 3 main hypotheses. The first one is the skill acquisition. So we expected that the training with haptic feedback would lead to better accuracy and also a steeper learning curve compared to the training without haptic feedback. The second hypothesis is about the user experience. We also hypothesize that with haptic feedback, the participants will give higher usability and presence score to the system. And the third hypothesis is about the skill transfer and retention. The first one is that VR training with and without haptic will give better performance than the control group. And mainly, or most importantly, that the VR with haptics will provide best retention and fewer errors over time. And here we can see our experimental setup. We have the physical simulator with the microscope, the tool, which is a pen, and also the grid. And then the virtual reality simulator with our Quest 2 headsets, the haptic device with 3D OFs, and the virtual grid. The difficulty was increased by placing the grid on a vertically movable platform to introduce pressure sensitivity. As you can see here, the blur effect, too much or too little pressure will give a blur effect, and when you apply the ideal amount of pressure, the grid will be steeper and clear. So now to our procedure. All participants started with instructions for sure, and the 3 groups did 2 trials of pretest in the real prototype or the real simulator. Then only the haptic and non-haptic groups did 6 trials in the VR. And then we have 2 trials of post-test for the 3 groups. And after a week, they all came back for a retention test, which was also 3 trials in the real setup. And here you can see from the videos how the training was in the VR and in the real setup. So we collected both objective and subjective data. The objective measures was the accuracy, the error rates, the completion time, and the force applied. And for the subjective measures, it was about the presence and the usability questionnaires. So now the results of our study. Let's start with the training phase. So as you can see, both the haptic and non-haptic group demonstrated reduction in error rates and also increase of accuracy, but no significant difference were observed between both groups. And unlike accuracy and error, the completion time didn't improve with training, which means that training didn't make participants faster regardless of condition in the VR environment. Now the subjective measures. Even though performance differences between groups were not significant, participants actually in the haptic condition rated the simulator as more realistic and usable, especially in the possibility to examine the dimension. And when we look now to the result of the pre-test, the post-test, and the retention test, which were in the physical prototype for the haptic, non-haptic, and the control group, when we look, for example, at the accuracy, we see a significant interaction between the test phase and group. The control group's accuracy actually dropped at retention. The no haptic group improved from the pre-test to the post-test, but this gain was not well maintained. However, the haptic group was stable or even improved accuracy between the post-test and the retention. For the error rates, we found both main effect and an interaction. Overall, the haptic group achieved the largest reduction in errors from the pre to the post-test, and they maintained this advantage at the retention. The no-haptic group improved in accuracy, but this came with more errors, suggesting a riskier strategy. So the control group reduced errors also, but at the expense of accuracy. In summary, haptic feedback led to more cautious and stable performance, while the no-haptic participant traded precision for riskier attempts, and the control group never reached an optimal balance. For the result of the completion time, so the results show that participants were significantly faster in the post-test and the retention test compared to the pre-test. However, there were no difference or significant difference between the groups, which means that all participants, regardless of condition, became quicker over time in the real or the physical prototype. And here we come to the main findings of our study based on all these results and hypotheses. So first of all, yes, VR training works because both haptic and non-haptic group improved performance compared to the control group. The user experience also enhanced with the haptic group because they rated the simulator as more usable and realistic. And the haptic group outperformed others in accuracy and especially in the error reduction at post-test and retention, as we saw in on the graphs. And one of our main also findings is the different learning strategies. So the no-haptic group, they built or they developed a riskier approach, which led to more errors. But the haptic group they developed a cautious approach, which led to a stable accuracy and long-term benefits. And from here, we can say that visual-only VR improves performance, but haptic feedback adds long-term stability, realism, and error reduction, making it crucial in microsurgical training. And like any research, of course, we had our limitation that we want to improve and we want to work on in our future work. So we had a minimum power achieved, but we want to expand, or we aim to expand the participant pool to include experienced surgeons and more participants in general. Also, we want to test more ecologically valid tasks, like suturing, for example. We want to extend the retention period for long-term transfer. They can come back after 4 weeks, for example, or for maybe a month or 2 months to see the long-term transfer of skills. And also, we aim to increase the training duration to observe sustained learning curves. And we want to integrate force recording for deeper motor control analysis, because we did that, but we had a problem with our software, so we couldn't work on that in this paper. And at the end, we also want to explore different levels of haptic fidelity. So this is our study and our study findings. I tried to be brief, and I will be happy to answer any questions. Thank you.
Thank you for the talk. Is there any question from the audience? Please raise your hands or they'll come to the mic.
I'll just apologise if I have missed this. Who were your subjects exactly?
My subject?
Yeah, the participants.
It's about studying the impact of haptic feedback.
Oh, yeah, I know that. Who were the subjects, the participants?
The participants, they are normal people with no prior experience in medical or surgical skills.
Right, okay.
Yes.
So your next step is to take people who are, medical, and to actually explore that one, yeah.
Exactly,
okay.
because a lot of research are also exploring the difference between surgeons and novices, experts and novices, so we want to do that also in our future work.
Also, there are people who aren't surgeons who do suture as well.
Can you please repeat?
So that's, but microsuturing is a specific skill.
Yes.
So that would be really important to look at those specialties like vascular surgery or plastic surgery. Yeah.
Yeah,
Just-
exactly. It's just like a,
Yeah.
thank you so much for your question. It's just a basic skill, like it's a warm-up procedure before starting the microsurgery, but we aim to work on more complex
Yeah.
procedures later. Yeah.
I agree, and it's important to demonstrate the value of haptics. Yeah.
Yeah,
Yeah.
exactly.
Thank you.
Thank you so much.
One more quick question. If not, please thank the presenter and continue to the next talk.
Thank you so much.
Okay, please start your presentation.
Okay. Good afternoon, everyone. I'm Yang Zhao from CIFAR, Shandong University, Jinan, China. It's a pleasure to be here today to share our work on developing a personalized multi-sensory virtual reality ecotherapy system for children with autism, which we call PMAS. Let me start by giving you a little bit background. Autism spectrum disorder, or ASD, is a neurodevelopmental condition characterized by challenges in social interaction, communication, and motor functioning. In recent years, the global prevalence continues to rise. This has created an urgent need for more effective and engaging rehabilitation methods. Traditional ecotherapy faces two major limitations. First, it places a heavy workload on therapists. And second, it often fails to keep children engaged over a long period of therapy. This is where virtual reality or VR offers new possibilities. VR can provide immersive, safe, and motivating environments that make therapy more enjoyable. However, most existing VR-based systems are generic and unimodal. As a result, their therapeutic effects are limited. Recent studies in multisensory integration suggest that combining different sensory channels can enhance immersion and emotional engagement. But in the field of VR-based rehabilitation, the olfactory modality has been largely neglected. This inspired us to explore a personalized multisensory VR ecotherapy system that could make therapy both more effective and more engaging for children with autism. In addition to this motivation, another key challenge lies in evaluation. In most clinical settings, the effectiveness of therapy is still judged using subjective behavior scales. These scales depend on human observation and often lack objectivity and consistency. To address this issue, we turn to functional near-free-rate spectroscopy, or FNIRS, which is a non-invasive brain imaging technique that can measure neural activation in real time. It allows us to quantitatively track changes in brain activity as the therapy progresses, offering a more objective and data-driven evaluation framework. Based on these motivations, our research focuses on two main questions. First, can a personalized VR ecotherapy system with multisensory synergy enhance ecotherapeutic efficacy? And second, patient ecotherapy is a long-term process. How can we quantitatively assess the impact of the ecotherapy? To answer these questions, we developed a system called PMAS. The goal of PMAS is to create immersive and personalized therapy experience through multisensory interaction. During training, the child wears a VR headset and an olfactory generator. They freely navigate within virtual scenes and perform object grasping tasks that appear during exploration. Each task is accompanied by background music and corresponding scenes, aiming to enhance sensory engagement and emotional connection. Technically, the system adopts a clinic-server collaborative intuitive architecture. On the client side, we developed PMAS on MetaQuest 2 headsets. The client is responsible for rendering the virtual environment and handling all user interactions. On the server side, several intelligent models are integrated. First, we use ChatGPT to analyze each child's sensory preferences and recommend personalized virtual scenes. Second, we use Suno AI based on music gene to generate real-time background music that matches the emotional tone of each scene. Third, the Accent 3 device provides olfactory feedback by releasing scents. All data are stored in a MySQL database to support later analysis. And now let me explain how we personalize the therapy environment. At the beginning of the session, ChatGPT generates a short multi-sensory questionnaire. The questions cover dimensions such as shape, color, music, and scent. And the child, with assistance from staff member, selects their preferences. Based on these responses, the system analyzes the sensory profile and automatically recommends one of several present scenes, such as a forest, a park, or a candy tone. Then, the music generation model creates background music that matches the emotion and rhythm of that scene. During therapy, the system continuously synchronized the visual, auditory, and olfactory feedback, achieving truly multisensory training. And to evaluate the system, we conducted a 4-week experiment involving children with ASD. The experiment was divided to 2-week cycles. At the beginning and end of each cycle, we collected the FNIRS data. And before the experiment, behavior assessment was conducted using Gazelle developmental schedules, which measure adaptability, growth, and fine motor skills, language, and social behavior. At the same time, we used FNIRS to record brain activity while children performed VR-based grasping tasks in their personalized scenes. During each experiment as system design, the large model analyzed the ASD kids' personal preference based on their choice and recommended corresponding VR scenarios. And the child wore VR headset, scene emitter, and FNIRS data acquisition device, and the child performed grasping tasks. And FNIRS is particularly suitable for this kind of study because it's safe, portable, and tolerant to movement, which is essential when working with children. It measures changes in brain, providing an indirect indicator of brain activation. We divided the FNIRS channels into 6 regions: the left and right prefrontal cortices, the left and right motor cortices, and the left and right occipital lobes. To ensure data quality, we applied several pre-processing steps, including outlier correction, artificial removal, and bandpass filtering. After pre-processing, the signal becomes much smoother and more stable, providing a strong foundation of analysis. And our results revealed several interesting findings. First, average activation across all 6 brain regions increased progressively over the initial sessions. This suggests that the children were becoming more engaged and actively participating in VR tasks. However, after repeating training, activation in the prefrontal and motor area began to decrease slightly or plateau. This may sound counterintuitive at first, but in fact, it indicates that the children's brain were becoming more efficient. They needed less effort to perform the same task, showing signs of improved neural adaptability. Statistical analysis using Friedman tests and Wilcoxon comparisons conferred significant changes, especially in the frontal and motor regions. In summary, extended training with the PIMA system lead to measurable improvements in both cognitive and engagement and neural efficiency. To conclude, let me summarize the key findings. First, our personalized multisensory VR system successfully enhanced the therapeutic experience for children with autism. Second, the integration of FNIRS allowed us to monitor and quantify neural changes objectively over time. Together, these results demonstrate that personalized multisensory interaction in VR can lead to more effective rehabilitation outcomes. Looking ahead, our future work will focus on two directions. We plan to expand the diversity of virtual scenes to better match different scenery profiles and maintain long-term engagement. And we aim to simplify the preference selection process, making it more child-friendly so that children can participate and more independently. Thank you very much for your attention. I will be happy to take any questions.
Thank you for the talk. Is there any question from the audience?
Hello, I'm Maria Gorlatova from Duke University. Thank you for the talk. This is fantastic work. Can you talk more about your participant selection? What age ranges you have considered, and whether you've how you've narrowed it down to children with certain ASD levels or ASD-related challenges? Because it seems like this is a lot for a person with ASD, your study.
The participants selection is in a central of rehabilitation. There are about 200 kids, and we make about 20 of them, and after the selection, 12 data we have used in this study.
But how did you select them? What age ranges you've considered, and what were the diagnostic criteria for inclusion and exclusion in the study?
We select them with the guidance of the worker in the rehabilitation center. They told me this boy, this boy is ASD kid, but he would told us this one could do our research, and that one if it's if the kids do not suitable in this study, they won't told us he is okay.
And what were the age ranges?
Huh?
What were the age ranges of the children?
I can take this. They are about 6 years old to 12 years old.
Thank you. Thank you.
Oh, thank you so much.
Thank you. Is there any question? So I'm just curious that how the children do you try to remove the headset during the task because they may not want to follow them.
It seems difficult, but in the daily training, they won't take the FNES device. They only take the VR headset, and with the help of the workers, it could it could do this.
Okay, thank you very much.
Thank you.
Thank you, Doug. Please thank the presenter again. Okay, let's start.
Yeah, thank you for having me. Our presentation is about forehand tennis training in virtual reality, where the user receives automatic feedback on their technique. So in tennis, there is limited availability of tennis courts and also qualified coaches. So there's a challenge of regular on-court practice. On top of that, the overuse of poor tennis technique can increase the risk of injury. So the question is how to address these barriers to traditional coaching and support regular practice with proper tennis technique. We addressed this question by investigating a form-focused VR tennis training where we had two objectives. The first is to facilitate a proper tennis technique. So we wanted to promote both the understanding and the application of correct tennis technique. By focusing the training more on the technique and the form, and providing automatic feedback to the user that's aligned with traditional coaching. The second objective is to encourage a regular practice by providing a virtual training environment as an alternative to the physical tennis court, which allows short self-training sessions in VR. And to increase the accessibility of this training, we wanted to minimalize the hardware setup. So we are utilizing the MetaQuest as the head-mounted display with two controllers, and for the user study also the racket handle that you can see on the slide to facilitate a more natural tennis motion. We utilize this hardware setup also for the motion capturing, which means that we only have partial motion capturing of the head, hands, and the racket available. And this really restricts the type of feedback that we can provide because, for example, we do not track the feet, so there's no way we can provide any feedback for the stance of the tennis player. We've built our solution on top of an existing VR tennis application called Tennis Esports, which has their own custom ball physics. In order to integrate automatic feedback there, we first need to capture the user's motion. Then we can assess the motion to find any motion errors or improvement in the technique. And finally, we can provide multimodal feedback to the user. The VR tennis training itself is conceptualized as target practice, where the action goal is to strike the incoming ball with a proper tennis forehand, imparting topspin on the ball, and then hitting the target on the other side of the net. After each shot, the user then receives feedback on their technique. While capturing the motion of the user, we analyze the motion by utilizing so-called coaching rules that are also already established in traditional tennis coaching. So these rules define either the optimal state of a motion feature or the characteristics of a motion error. We have two types of coaching rules. We have binary classifiers, for instance, whether or not the user hit the ball. And we have those where we can calculate a quantitative error matrix. For instance, the coaching rule that you can see here on the slide says that the user should hit the ball around waist height. We have defined around waist height by thresholds above and beyond the waist level, and we define these thresholds with collaboration of tennis coaches. And then we can simply use the actual contact point where the racket meets the ball and calculate the difference to this tolerance level. So this coaching rule is only defined for the contact point and not for the whole motion of the forehand tennis. So, and that's the case for all of these coaching rules. So we first need to segment the recorded forehand tennis stroke into the motion phases that you can see here. And we divide the motion into these smaller units by using a feature-based approach. We mainly utilize the ball collision and also the racket movement, like extreme values. A challenge here is that we cannot assume that the tennis player has a perfect technique for the segmentation, so we need to account for any mistakes or individual motional styles. And you can see here in the image below that there are various ways how to perform a motion phase correctly or incorrectly, and we need to segment all of them as the backswing in order to provide any feedback for this motion phase. So we first segment the motion into these phases, and then we evaluate a set of coaching rules for all of them, or for each of them. And we have around 50 coaching rules, so providing feedback on all of them at once might be a bit overwhelming to the user. So we utilize this decision tree to select one coaching rule at a time for feedback administration. Hereby we prioritize improvement, so if a user improved based on the prior feedback, we provide positive feedback on that coaching rule. Otherwise, we will select a relevant mistake to provide corrective feedback on, and this is based on multiple factors such as the performance score that the coaching rule achieved, and also prioritization that we defined with coaches, and also follow-up errors, etc. So after coaching rule selected, we provide multimodal feedback. We provide auditive and visual feedback right after the forehand stroke, and we provide haptic feedback at the moment of ball-racket collision. Here in the screenshot, you see the point of view of the user after finishing the racket stroke. On the right side, there is a motion replay where the user can rewatch their motion. And there's also a path that shows the racket's motion segmented into these motion phases. On the left side, there's a UI where the coaching rule is explained, together with color coding and the performance score that the user achieved in this coaching rule. And you can also see on top that there's another score, which is the overall performance. So this is an aggregation of all the coaching rules together. And if the user wants, they can also select a detailed view and then showing all the results of all the coaching rules and motion phases. So here's a short demo of our VR tennis training. And in the first stroke, the user will do a mistake. And I will try it, because the audio doesn't work, I will try to output it on my phone.
Carry out the follow-through by finishing with your racket over your opposite shoulder. Don't stop short.
So here, the system detected that the user did this motion error and provided corrective feedback.
Way to go. You carried out the follow-through.
So in the second attempt, the user implemented the feedback, and again, the system detected this improvement and provided positive reinforcement. We evaluated our system with experts while we implemented it, but when we were finished, we also evaluated it with a user study following a within-subject pre-test, post-test design. You can see the user study procedure here on the slide. As intervention, we let participants train for 10 minutes with our VR tennis system, where they received automatic feedback after each shot. And they were instructed to really try to focus on improving their technique. Before and after that, we had a VR performance test, which was a target practice without any feedback, which we utilized to measure any performance metrics like outcome, like aim and spin, but mainly focusing on all these coaching rules. And in between the VR sessions, and also at the end, we had questionnaires. And this allows us to compare the measurements from before and after intervention. And at the end of the user study, we also had a questionnaire with a lot of open-ended questions to get more detailed insights into what participants thought. And we evaluated using a qualitative coding analysis. 26 people participated in our study, 19 male and 7 female. And we had 2 players that played with the left hand and all the other played with the right hand. We focused mainly on tennis player with a tennis skill level from none to intermediate. And the VR experience also ranged between none to people that really use VR regularly. So for the quantitative evaluation, we had 3 hypotheses. 2 of them you can see on the slide. The first is that participants' motivation to practice tennis is greater after our VR training. And the second one is that also their confidence level in their own forehand technique is greater. We measured this by having liked items in the questionnaires before and after intervention where they could rate these 2 aspects. And you can see again the results in the chart here. And what you can see is that both motivation and confidence in their own skill increased. And this increase is actually significant based on the Wilcoxon sign rank test. Our third hypothesis was that the measured performance metrics that we took in these VR performance tests before and after intervention is higher after the VR training compared to the baseline measurement. You can see again the results in the chart here. So this is the overall performance score that aggregates all these coaching rules together. And you see the pre and the post results. And again, there is an increase that is significant. But we wanted to also look more into the detail of how users performed in the different motion phases. So we calculated performance scores for each of these motion phases by aggregating just the coaching rules for each of them. And you can see the results here. All of them increased, but 2 of the motion phases are not significant. So both coaching rules for the contact point and coaching rules for all outcome-related measurements, so which is called here execution, are not significant. We also ask users to rate the helpfulness of the feedback modalities, like motion, replay, haptic, and so on. And actually, they rated all of them as helpful, except for haptic feedback, that there is really a mixed result. And we found out due to the open-ended questions that the haptic was just too weak. Some didn't notice that. And while there was not really a clear preference for one feedback modality, some users mentioned that they really liked the audio feedback, but it got really repetitive over the time and some of the formulations were too long. So in conclusion, our quantitative results show a significant improvement in motivation, confidence, and skill and performance, so our hypotheses are supported and indicate a potential short-term learning effect. And this is also supported by the qualitative insights because most of our participants mentioned a noticeable skill improvement or at least a progress during training, and also a lot of them mentioned a knowledge gain, even intermediate tennis players. But there are also system limitations. So as mentioned, we only have partial motion capturing and there are feedback design flaws. And also the study design, so we had no control group, so we cannot really isolate the effects of the VR training, so what caused the performance increase. And also, we only measured the short-term effects right after training, so no long-term studies or skill transfer to the real world. In conclusion, we provide a VR-based tennis motion learning system that works with a really minimalized hardware setup and provides feedback automatically to the user. And this is publicly available as an extension to this tennis VR application called Tennis Esports. And the user study insights suggest a motivational and short-term learning effect. And users found it quite engaging, enjoyable, and also more accessible than a physical court. And most of them also find it a valuable addition to traditional coaching. So thank you, and are there any questions?
Thank you for the talk. So please start your question.
Thank you so much. Can you hear me okay? So you talked about the different types of feedback with haptic, audio. I also noticed from your video the visual feedback with the paths and the immersive court. Did you get any feedback on the types of visualization techniques you were using and what was working well and what could be improved?
Yes, so maybe I jump back to a slide where you can see the visual feedback. So what really worked well And a lot of users mentioned it as one of their preferable feedback was the motion replay. So what was a bit confusing at first was the UI on the right side below the motion replay. So there you can select the motion phases to replay them, and a lot of users were confused also because of the color coding that is also in the motion phases. So something that we learned is that we use a lot of color coding, and we should really focus on one color coding and not have so many different colors. But everything else was really appreciated and worked, and yeah. Thank you for your question.
Thank you.
Thank you. Fascinating work. It's clear that you will really learn from using the system. That's really cool. I have a question. So, do you have a sense of how often the system will give feedback that's not exactly right? Whether for technical reasons or for that individuals are different? Do you have a sense of when the feedback is very wrong or a little bit wrong?
We do not really measure that one. I think most of the time it really works pretty well, but there are problems with the motion phase segmentation.
Okay.
So in certain circumstances, this will not work well, and then also the coaching rules are not correctly evaluated. And we often then opt out to provide feedback for this motion phase and just tell the user that that motion phase could not be segmented.
Ah, okay. Okay, so you tell the user that this, rather than giving wrong feedback, you say that there's no, okay, cool. Okay.
Or yeah, we rather take feedback from another motion phase, but yeah, either that, and also we have really lenient thresholds for all these coaching rules, so that there is a bit of an error that we can, so that the coaching rule is not too strict, or yeah.
Okay, thank you, thank you.
Thank you for the presentation. Sorry if I miss it, but was any human tennis coaches were involved in the process of the metric design? And also, was there any feedback from human coaches as well?
Yes, so actually we have multiple coaches that worked with us to incorporate the coaching rules. So we went, so the coaching rules are from tennis coaches and also from literature, and not all of them are applicable to our system, so we asked tennis coaches about that. And also while developing, we had an iterative expert evaluation, so we tested the system regularly with the tennis coaches that provided us the coaching rules, but also with tennis players. And they tested all these thresholds, they provided feedback, and so on. So yeah, they were quite involved.
Thank you.
Thank you.
Thank you very much. Thanks to the presenter. And because the one presenter is missing, so this is the end of the session. Please applaud for the presenters for this session.